Hi, hello, and welcome to another episode of Vibe with Dr. Apu. Today, with me, I have the very renowned physician, someone who is absolutely dedicated in his profession. Not just that, has taken so many initiatives to bring about change and help children across the world. Yes, so with me is Dr. Zainul Abidin. Doctor is not only the medical director of Hope Children Cancer Care Center, which is a registered charity organization in India, Kerala. He's also the head of hemato-oncology, pediatric hemato-oncology and BMT at Burjil Medical City. It is an absolute honor and a privilege and a pleasure. And I'm sure this is going to be a very inspiring podcast session. Hope you feel the same. So, welcome to the podcast session, Doctor. Thank you so much for joining us.
Thank you very much for this opportunity.
Now, I would like to ask you, my first question is, what is Hope?
Hope is a charity organization based in Kerala.
Okay.
Hope Beyond Leukemia is one of their innovative project.
Okay.
In fact, Hope Beyond Leukemia is a kind of a scientifically driven
Okay.
and social initiative.
Okay.
It can be implemented any part of the world. Scientifically, acute lymphoblastic leukemia, that is the most common childhood cancer and easily treatable with more than 90% of children nowadays can be cured with available treatment. So the hope beyond leukemia is to make sure every child will have a chance to get this treatment so that we can ensure the outcome is best.
Okay, doctor. Moving on to the second question or the next question. Why did you choose leukemia as the focus of this project?
I mentioned before, leukemia, especially acute lymphoblastic leukemia, is the most common childhood cancer. That is having the best outcome with available treatment. That's why we thought we will begin with leukemia to focus to get the best treatment for all children in Kerala.
Continuing, doctor, why did you use the term hope beyond leukemia?
To understand hope beyond leukemia, I think we need to go back to the history.
All right.
If you read about the story of treatment of leukemia, how it has been developed in probably 4 to 5 decades ago in 1940s, even in the best hospital in Western world, all children who were treated with available treatment at those time died. So that time it was a considered leukemia beyond hope. However, over the last 5 to 6 decades, because of scientific research and progress in the scientific field, medical field, we have achieved a situation where more than 90% of children with acute lymphoblastic leukemia can be cured. So that now it start with leukemia beyond hope. Now hope beyond leukemia.
Now, what are the challenges of going ahead with hope beyond leukemia, doctor? Isn't it really challenging to take?
Yes, I think this is depends on where the children born and where they were diagnosed. So basically, as I told you, that the treatment is available and the result is very good and it is not that expensive. However, the many part of the world, all children diagnosed with acute lymphoblastic leukemia, they don't have access to this treatment.
All right.
The challenges mainly, one is the awareness and understanding of the parents. Even well-educated, well-to-do family, they don't know what is the best treatment and where it is available, and they are confused when their children get diagnosed.
Okay.
So there is a lot of misguiding, misunderstanding. So there is a delay in diagnosis as well as delay in getting the best treatment. Another challenge, obviously, the finance reason. Many families, they don't have, even though the cost of treatment is not that expensive compared to other children with other cancer.
Yeah.
Cost of treating children with acute
Lymphoblastic
lymphoblastic leukemia compared to treating children with other cancer is not that expensive.
Okay.
However, still some families, because of the financial constraints, they don't get the best treatment. So these are the main challenges, the reason behind why all children with acute lymphoblastic leukemia not getting the cure what we have achieved internationally.
So, doctor, how is the program going to be implemented in practice?
I mentioned that it is a scientifically driven concept.
Yes.
And everyone knows that childhood acute lymphoblastic leukemia is curable in most of the cases.
Yes.
So when I discuss this concept and idea with Hope Children Cancer Foundation, a charity registered in Kerala, they have accepted this project as one of their important activity project. The reason is they have a very good track record of supporting, helping children with cancer in Kerala. They have been there for last more than 8 to 9 years.
Okay.
So they have piloted this project in Kerala. They have made MOU with pediatric oncologists who are currently working in Kerala.
Okay.
And they make sure all those children enrolled in this project getting treatment with international standard, and all those children as well as family, they provide accommodation near to the treating center, and they supported psychologically and they also supported financially whenever these children needed to cover the expense of the treatment. So with that pilot study, we found that over 90% of those children are doing very well. From that experience, they are going to implement this project next few years to make sure many children with acute lymphoblastic leukemia are saved with the best treatment, and their families are supported psychologically, financially during that difficult period of cancer treatment journey. Now, doctor, what is your role as a doctor in this initiative? Being a pediatric oncologist, I have treated several children with acute lymphoblastic leukemia, both in UK as well as in Abu Dhabi. It is very clear to me that acute lymphoblastic leukemia in children is easily treatable, and we can make the best result wherever you implement this concept. So, as a doctor, my main role for this project is to support Hope Children Cancer Care Foundation in their noble initiative, commitment to take this concept project forward personally as well as professionally to make sure those children are getting the best treatment by their doctors in Kerala. This initiative started, I think, 8 years ago, doctor, and we were able to help so many children with acute lymphoblastic leukemia, right? Correct. Hope Children Cancer Care Foundation started around 8 years ago, and they have established hope homes around many hospitals in Kerala. So that families with children with cancer can stay in their hope home when they get treatment. Hope Beyond Leukemia is another new initiative. In fact, they have piloted and they proved by themselves that it is realistic and it can be implemented in Kerala realistically.
So that is a brilliant initiative and a solid bit of information that we've understood from what Dr. Zainul Abid has discussed is that acute lymphoblastic leukemia in children is treatable and curable. And yes, now it is not leukemia beyond hope, it is hope beyond leukemia. So great initiative, Doctor. Thank you so much for your valuable time. And it's a great initiative, and I'm sure it's going to help so many little ones have a better life and also help their family restore hope and happiness. Thank you so much.
Thank you very much for this opportunity. I'm sure many children can be cured and saved in next few years through hope beyond leukemia.
Thank you so much once again, and we'll be back with another guest in the next podcast session.